You are listening to Reduce the Stigma, CJ106 docu-series funded by the Community Radio Fund of Canada. This series aims to provide information on local services, bring to light the work of healthcare professionals, and most importantly, reduce the discrimination faced by people with direct lived experience with a mental illness.
Hi, my name is Ainsley Friesen. I am 36 years old. I am currently a music teacher and a singer-songwriter. I have a diagnosed bipolar 1 disorder, and I was diagnosed when I was 20 years old.
What was life like before you sought a diagnosis? What was your daily routine? What were some challenges? And what led you to look for help?
I think what was confusing was that I was a teenager, and life was already confusing enough for any teenager. So I had a hard time differentiating between what was normal and what wasn't for my emotional upheaval at the time. I remember being extremely emotional a lot of the time, and but then other times very creative on a real high for that too. So I don't remember as much as I used to about what life was like. It's been a long time, and I've been diagnosed mostly as an adult most of my entire adult life. My first manic episode, it was very confusing, and I remember a lot of very confusing events, but at one point I do remember being coherent enough to think, okay, there's something wrong with this situation. I think I have some problems here.
How and where did you find help? And what resources were available for you to use?
I think what's the hardest thing when you're first being diagnosed is finding the right support network. It's so important to find one, and it's so easy to fall between the cracks because if you don't be proactive for yourself, no one else is going to be. So initially, I guess I sought help by going to the hospital, and eventually, with a hospital admission, etc., eventually you've got a psychiatrist, and then, with hospital admissions, there's counseling groups that come, there's outpatient treatment, all kinds of things like that I've been involved in.
What kind of help did you find in your search for resources? What programs and treatments were suggested or that you participated in?
I guess there have been various hospitalizations over the years, so it's been, different outpatient programs that I've been a part of, and many times after you've been hospitalized, they have group counseling sessions available for the outpatients to come back to and receive, and they usually tend to go on for several weeks to months, depending on the need and stuff. So I found the CAP in Brandon Center for Adult Psychiatry to be very helpful in a lot of my recoveries at different points in my life, and just the best treatment I've received in hospital has been at CAP for sure. And they do offer the outpatient treatment programs and coping skills. One thing I found that I really related to was their mindfulness meditation program that they do. I think that is one of the coolest things that they do there. Learning mindfulness is really important for, I think, anybody. So if you can learn to use that to cope with your illness, that is even better.
Mindfulness-based therapy. Was this helpful? How did life change for you?
It allowed me to see things from a different perspective. And when you can start to see day-to-day things from a different perspective and making the little things important, it kind of floods over into your more intense life that goes on in the rest of your mind the rest of the time. And I think noticing other things about other people, other living things, other even inanimate things is just such a cool thing to rely on, because you can always take your mind somewhere else if you need to. Having psychiatrists to talk to or counselors to talk to has helped me understand my condition, and understanding is so important. Getting the facts straight about what to expect for your treatments and what to expect for your recovery and all that. But also learning coping mechanisms and just how to live day to day. And a big thing I also want to point out is when you receive treatment from a professional, or when you are surrounded by other people that are going through what you're going through, I think it develops and continues to develop a sense of self-awareness. The more self-aware I think that you become of your illness, the better chance you have of coping with it and recovering with it.
What can you tell our listeners what it is like to live with, generally, about living with the direct experience of living with bipolar?
For me, life with bipolar disorder is not as bad as it used to be, that's for sure. I feel like as I've gotten older, things have in some ways become somehow a little bit easier. Not every way, but I think the biggest challenge is just maintaining the balance between that mania and that, well, the euphoric mania that doesn't make sense to the crippling, debilitating depression that you can't wake up from. So it's kind of always, you're always trying to find that middle ground. It's a struggle.
Stigma and mental health. When you're discovering that you might need to find help, was there stigma attached to mental illness that was probably maybe preventing you from actually seeking help?
I think so. I think I felt at the time I was very young when I was diagnosed. Not very young, but young enough. And I think what was hard enough was the fact that I put so much pressure on myself to be able to succeed and do everything. I remember I left home right away, right after high school, and just expected myself to work and take care of myself right away. And it was so hard, and I couldn't keep a job down at all to save my life, and jumped around from jobs to jobs constantly. And that was a really, really hard thing to deal with as well. I put a lot of pressure on myself to be able to solve all my own problems. And I also think that I expected that I would be taken care of and things would get better as long as I put my faith in the faith that I'd been taught growing up. And so the fact that I was finding that was failing me was a really crushing experience. That faith that I felt should have been there for me, that was crushing as a young person to discover that a lot of things that you thought aren't really what they are for you anymore. By the time I was in need of help, there wasn't really any time for a whole lot of stigma, if you know what I mean. And I think the stigma came later, but in the moment when it was time to get help, there wasn't it was get help now. This is an emergency. So the stigma definitely developed and came later and continued.
You living with bipolar, since diagnosed, you've been fairly out with your condition. You talk to people, you're not shy. But how was living with bipolar? Did you ever experience a social shame or stigma given to you by other people because of your mental illness?
I think the biggest place that I've experienced stigma issues is in the workplace. And in the past, this has been very difficult, but currently my job is very understanding and I really appreciate them. As far as friends, I don't experience stigma with them. I find them to be very understanding and they're pretty awesome.
What are some things people should know about people who have direct lived experience with bipolar? And how do we best correct misconceptions, if any, and or stop the discrimination?
I think some things that people should know about people who live with a bipolar condition is that I think they're trying very hard to maintain a balance. I think balance needs support of the community. It requires community support to create that balance for people. And so I think we need to surround people with mental illness, and if I'm speaking from bipolar disorder specifically, as a community more. One thing that has always bothered me is when someone throws around the phrase, oh, she or he is totally bipolar, or they went totally bipolar on me, or whatever, and that kind of thing. I think that can be really, really hurtful. I think a common misconception is that people have sometimes is that people living with a bipolar disorder are always unstable and that they're constantly in this up and down issue. And I think that's not true. I think that maybe people don't always understand that we can live a happy and very successful and functioning life and lifestyle, even amidst the challenges.
Ainsley, you're a gifted singer and songwriter, and Brandon, I always wanted to ask you, how does writing and performing music relate to the experience of having lived with a bipolar condition? Do you find music therapeutic?
Absolutely. Music is extremely therapeutic, and to be quite honest, I don't know what I would do without it. So absolutely, it's interesting when I'm writing music, often best songs come out of a real manic swing, but it is very cathartic. It can be very therapeutic. You know, it's funny, but I guess for me, I think it mostly stays on the euphoric side of things. When I start writing, I can't stop that feeling. It's quite a lovely experience writing, and sometimes I get triggered to feel lower in my mood from music I listen to.
Many performers also experience anxiety before a show, or maybe some different behavior. They might exhibit some pre-show ritual. How was the performing experience for you?
I really love performing, but it takes me a good 10-15 minutes to really dig into a set and start to feel comfortable on stage. It's difficult because one of the side effects I have from a medication is a pretty noticeable tremor, and when I'm nervous, it's even more noticeable. So I feel really self-conscious about that, and I feel that people can see that. So it makes me feel a little more self-conscious, wondering if people think I look really nervous, because I don't ever want to look nervous. A performer never wants to appear nervous on stage, right?
Well, I think that's very wonderful that you shared your story with us today, Ainsley Friesen. Thank you very much.
Thank you for having me on the show.
You have just been listening to artist, teacher, singer-songwriter, musician Ainsley Friesen. Ainsley was gracious to share with us her experiences and positive account of how the practice of mindfulness has helped her in her mental well-being and everyday life. My name is Jan Eck, and this is Reduce the Stigma. We hope that you find this series on mental health and resources in the Westman region both informative and helpful. We are glad to be bringing to light many issues of mental health and wellness, a topic that in the past had long been discussed in hushed tones or suspicious whispers. Today it seems like we are in a new era of openness about mental health. We want to talk about it because it is something that affects all of us. The more we can talk about it, the more we can destigmatize what we previously held as fearful, unknown, or as something that other people went through. For a mental illness sufferer, talking about it might mean that some people are listening. It could mean that their concerns are being taken seriously. But it definitely means that they are not alone. Chances are you or someone you closely know currently lives with a mental illness. Yet despite an explosion of information in popular culture surrounding mental health and well-being, stigma remains a barrier to community acceptance, diagnosis, and treatment. By promoting resources that can help people, by discussing the nature of mental well-being in an individual and within society, and by listening to the stories of people living directly with mental illness, we hope to demystify the experience and reduce the stigma against those suffering from very real medical conditions. In this episode, we will talk about mindfulness-based stress reduction therapy. MBSR is a resource or practice with proven clinical results that can help people on a daily practical level to cope with persistent and acute depression, bipolar disorder, anxiety, and many other mood disorders. MBSR also finds practical use in maintaining our general mental well-being, providing a clarity and focus that can help us through the more chaotic days, and reducing the negative stress that can lead to serious illness physically and psychologically. There is positive stress, it's called eustress, and that provides motivation, adaptation, and reaction to the environment that helps us excel at physical performance and can be wanted and healthy for the active individual. Too much stress, however, causes distress and increases the risk of cardiovascular disease, ulcers, sleeping disorders, and many other physical illnesses. It can also lead to many psychological impairments, including the mood disorders previously mentioned, and also debilitating panic attacks, phobias, and PTSD or post-traumatic stress disorder. We treat stress in many ways. We relieve stress by talking with others, by petting our cats and dogs, by getting fresh air. We take medications. There are many therapeutic interventions, group sessions, and individual counseling. Mindfulness-based stress reduction is often used in these settings, but one of its greatest strengths is that as a therapeutic practice, it is something you try to live by in the moment, something to try in everyday life, to change your perceptions about challenging situations, and allowing yourself to reevaluate your reactions by yourself in almost any environment. Our featured interview this episode is with Rick Pichet, a registered psychiatric nurse at CAP, or Center for Adult Psychiatry. With Dr. Karen Arduzzi, also from CAP, they conduct mindfulness-based stress reduction seminars that can be accessed by the public comfortably within the Brandon region. Let's start with a brief introduction your name, credentials, and perhaps your education and training, and what led you to working with mindfulness-based stress reduction.
So my name is Rick Pichet. I have been practicing as a registered psychiatric nurse for about 31 years. Seems like a long time, and when I got into the profession, I worked with lots of different people with different years of experience, and I thought 31 years, 25 years that these people have, and I thought, oh my God, I'll never see that. And here I am 31 years later, I'm still working in mental health. I've been working in mental health, like I say, for 31 years in Brandon, in a variety of areas, ranging from working with adolescents to the elderly, chronic care elderly, and acute care elderly. For the past, I guess about 21 years, I've been working with acute care adults. And acute care adults is 18 to 65 years of age. I currently work at the Center for Adult Psychiatry. Here at the Center for Adult Psychiatry, we offer, amongst other things, like individual therapy, counseling, we offer group therapy. Group therapy is something that I kind of grew into and really liked. I like to deliver kind of educational topics to people and then kind of discuss them, kind of batter them around a little bit and pull them apart and find out what makes this applicable, how can this work for the individual. So about 10 years ago, I'm always kind of looking for new things in group. And I kind of stumbled across mindfulness. Mindfulness is, I guess the definition of mindfulness is a purposeful or intentional noticing or becoming aware of the present moment and not judging it. And some say, and doing all of that with kindness and compassion. So it's basically becoming aware of the moment, being in the moment. So I started to learn about that and to deliver that message here at work. And then about 5 years ago, I was able to take my mindfulness training. The specific mindfulness training that I received at that time is called Mindfulness-Based Stress Reduction. Mindfulness-Based Stress Reduction, or I'll refer to as MBSR, was first developed and brought to United States by a guy named John Kabat-Zinn, and he is working out of the University of Massachusetts Medical Center. He developed a 8-week program that is all about mindfulness, becoming aware of your mind, body, and spirit, and deliver it to people at that time with chronic ailments, chronic conditions. So I've been practicing that for about 5 years now and delivering mindfulness-based stress reduction programs in Brandon about twice a year since then.
Thank you. That was a great introduction to MBSR, Mindfulness-Based Stress Reduction. I have a few more questions concerning. How is it similar or different from meditation? Can you give the listeners any detail of MBSR to better describe how it is used, how it works to relieve stress? Can you describe the spiritual roots of MBSR? And how is the practice now secular?
So the practice of mindfulness-based stress reduction and meditation are basically the same thing. Mindfulness meditation is part of the core practice in MBSR. So the MBSR program is an 8-week program. It's delivered to participants once a week for 8 weeks. Each session is about 2.5 hours long, and then there's a full day session between week 6 and week 7. And that's usually on a Saturday or a Sunday. And that runs from 9 to about 3:30. That's called the Day of Mindfulness. So 8 weeks, 2.5 hour sessions, and then one full day. During these sessions, we practice different meditations. We'll do a lying down meditation called a body scan. We'll do sitting up meditations. We'll do some mindful movement or light yoga. And after each practice, we do what's called an inquiry. The inquiry is kind of like checking in after the experience. Be like journaling at the end of your day. What came up? What did I notice? So exploring with the individuals, what did you notice during your meditation? Where did you notice it? So sometimes people say, well, I had a hard time concentrating. My mind just kept on veering off and I had lots of thoughts. Or I was consumed by the pain in my hip. People, when they're first trying meditation, they have a hard time with it because it's so kind of hard sometimes to be focused. So that's meditation is part of MBSR. And mindfulness is a type of meditation. There's different types of meditation out there, but the mindfulness meditation I like myself because you can practice it anywhere at any time with anyone. Sometimes people think that when you're meditating, you have to meditate in a quiet space. Has to be sort of the right conditions, or it's to be relaxed. Mindfulness meditation, like I say, you can do it. You could do it on a bus. You could do it standing in the line at Superstore when you're waiting to get through the line. It's taken forever, and you thought you picked the shortest line. Now it's the longest line, and you're getting frustrated. Well, I just noticed the frustration, noticed it in my body, and think, okay, I can either stand there being frustrated and suffer, or I can choose just to notice people. I can choose to notice my breath, and then all of a sudden I start to feel a little calmer, and it comes to the point where you're accepting of the moment. So that's mindfulness in MBSR. One of the other questions that you asked about is spiritual roots. Mindfulness has spiritual roots in Buddhism. The MBSR course that is taught here in Brandon by myself and my partner, Dr. Karen Narduzzi, she's a psychologist that I work with at the Center for Adult Psychiatry, has spiritual roots in Buddhism. Mindfulness is part of Buddhism, but we don't teach Buddhism. We're not practicing Buddhist practices. So it's secular that way. So mindfulness in Buddhism has been around for 2,600 years now. Mindfulness is a part of not only Buddhist roots, but it's a part of Christian roots, it's a part of Muslim roots, Islam. It's just being in the moment and accepting this moment as it is. All of us do practice that, but kind of the issue is that we're not always intentionally noticing or intentionally practice that. And so it's easy to get out of the moment, what we call being mindless, just kind of wandering aimlessly on autopilot. You know, some days when we're driving our car and we're driving home, we get home and we wonder, I don't really remember how I got home. I don't remember stopping at stop sign. Did I stop? Did I go through on a green light? I don't remember driving by the school, but I got home safely. I don't remember crashing into anyone. And so it's kind of a sign that we're probably a little overwhelmed, got too much on the go, and we're just going on autopilot. We're not being aware in this moment. So the secular path of mindfulness, I guess, was really started by John Kabat-Zinn and bringing this MBSR program to North America in 1979. It's delivered all around the world now to hundreds of groups all around the world, to deliver to thousands and thousands of maybe upwards of 30,000 participants now. And the cool thing about MBSR is if you've taken an MBSR course, say, in Canada or in the United States, and there's a day of mindfulness in Europe or Australia or UK, you could take in the day of mindfulness, that one day that's on the weekend, anywhere in the world if you are a MBSR participant.
How is mindfulness-based stress reduction considered sustainable? And what does non-striving mean in regards to MBSR?
Again, I mentioned that I got into the practice of mindfulness about 10 years ago. At that time, it was more of what we call an informal practice. Informal practice of mindfulness is kind of looking at the educational side and practicing mindfulness on a daily routine. So being mindful of my speech when I'm conversing with someone, being mindful of activities that I'm partaking in. So when I'm walking, I notice I'm walking. When I'm eating, I notice, that I'm eating. I'm tasting, smelling, noticing, feeling the texture, maybe hearing a crunch. So the informal practice was the practice that I did for about 5 years. And I started to notice that when I was teaching it here at Center for Adult Psychiatry, that it's different than the other coping skills that we teach here. And what I notice about it is that it's a process. Mindfulness is a process, and you can plug this formula into any aspect of your life. And the formula is the definition of mindfulness: intentionally becoming aware of this present moment, the moment that you choose to notice, and noticing it without judgment, and then being kind and compassionate to yourself. If you practice this with yourself, then you can be mindful when you're with others, and you can be mindful of your environment. So I noticed that you could plug this formula into anything, and it will take you to where you need to go. So the other question about non-striving, Mindfulness is a non-striving practice. One might think, well, if you're non-striving, you're not really getting anywhere. But it's not really like that. If you, let's say you're building a house, you first have to think of the plan, come up with a plan. You have to build the foundation, then you build the walls and the roof and the floors and windows and doors. So it's a process. You have an idea of where you want to go, but you need to let go of it as soon as you realize, okay, I have a goal, but I need to let go of that and start right here, right now. That's the non-striving aspect, is you can set goals, but then knowing that I have to be in this moment to attain them. And when you're non-striving, you might see some better options along the way. And so if you're just stuck on a certain goal, then you kind of have blinders on and you might not see options. You might not, kind of veer off your path. But when you're mindful, you're choosing healthy options. And you might notice something that is a better option for you. And along the way, this whole mindfulness process is a self-improvement process. And you might change the way you see things and change your likes and dislikes and maybe what you do or who you hang out with, what kind of activities you partake in. So in that way, it's a sustainable practice. It's something that is going to serve you now. It's going to serve you later. It helps you where you need to go through that whole process of setting goals, but letting go of the goal. You heard kind of the cliche. It's not about the destination. It's about the journey. So that's what mindfulness is.
Who can benefit from mindfulness-based stress reduction practice? What psychological conditions has MBSR been shown to improve? I have a few ideas: anxiety-related illnesses, but also post-traumatic stress disorders. Is it well used in the military, for example?
As I hope you can tell from my voice here, I'm very passionate about mindfulness and very passionate about mindfulness-based stress reduction. When I first got into it, I thought, who's more mindful than Tiger Woods? Because I'm a big-time golfer. So I thought, well, I think people will be able to relate to this at work, and it might help my golf game. But it really didn't help my golf game because I figured out later I'm still striving. So whenever I can let go of thinking about the end result and just stay in the moment of that swing, that's usually when I hit the ball well. And in the end, I'll get to where I need to go, and then I'll hopefully have a good golf game. And I noticed that it was helping individuals at work, and it was starting to help me. I noticed that I was becoming more responsive than reactive. And through this practice, I noticed that it helps anyone who wants to live more in the moment, anyone who doesn't want to suffer from, we're all stressed, and we actually need stress. They talk about eustress as good stress. But when there's too much stress, we become distressed. And then we talk about dis-ease. We can become uneasy kind of in our life, too much going on and too many expectations. There's kind of an offshoot of MBSR that was developed in the early 90s called Mindfulness-Based Cognitive Therapy, MBCT for short. At that time, there was a big sort of budget that was put into place for 3 psychologists to look at alternative therapies for depression. They looked at a variety of alternative therapies and found that the practice of mindfulness, and specifically the practice of mindfulness-based stress reduction, seemed to have a direct benefit on people who were suffering from depression. They might have rheumatoid arthritis, they might have multiple sclerosis, different chronic illnesses. And with those illnesses, people sometimes have anxiety and get depressed and lack motivation. But they noticed with those individuals that their motivation to get back to doing the things that they like to do really improved, and their depression improved. They became much more kind of at ease and happy in their life. So mindfulness and MBSR is very helpful for depression. They actually say that the practice of mindfulness is more beneficial than taking an antidepressant for mild to moderate depression. If you have endogenous, what these call endogenous or major depression, which is biochemical, you're still going to need a antidepressant or even electroconvulsive therapy, ECT, which is still used today and very, very effective. But for mild to moderate depression, the practice of mindfulness and MBSR is found to be very beneficial. They actually say if you've had depression and a relapse, by practicing MBSR, mindfulness, you can prevent a relapse by up to 56%. That number was about 40% a couple of years ago, and some recent studies have noticed that it's over 50% now. It's being used in jails, it's being used in hospitals, being used in schools. Goldie Hawn, Kate Hudson's mother, she's been a long-time practicer of mindfulness, and she started a program called Mind Up, and I believe it's in the Vancouver school divisions. And so kids will take these brain breaks, little 2.5-minute brain breaks 3 times a day, just to kind of just to be in the moment, to stop doing. And they really are noticing benefits for students. The UK, United Kingdom, has introduced a mission that all of the public facilities in the UK have some type of mindfulness structure to it. So we're talking schools, we're talking jails, health authorities, anything that's in the public system, they'll be taking some kind of mindfulness course. And I think 10% of the politicians in the UK have taken a mindfulness course. So it's being used all around the world. It's big in Australia. It's very beneficial for all kinds of conditions. The Marines are actually even practicing mindfulness, taking mindfulness-related courses. NBA teams, Olympic athletes, are practicing mindfulness because it helps them to focus in this moment, which helps you to get out of your head so you're not second-guessing yourself and you're kind of in that flow doing whatever you're doing. You're being in the moment with it without any negative commentary. With the military, kind of the big thing that we've been noticing in the last number of years that's coming up in the news a lot is post-traumatic stress disorder, and the depression and suicide rate in military, in the last few years is really skyrocketed. They're looking at alternative therapies, and one of them is mindfulness and MBSR. And I have facilitated MBSR with people of military background with PTSD. And what it gives you is it's kind of like desensitization. It allows the person to feel comfortable when something uncomfortable comes up, provide a safe environment for them, and stuff can kind of come up, whether it be sounds or thoughts. Lots of times it's thoughts and emotions that kind of rise with that. And we stay in our head, and we start to wonder about this, and we try and predict that. MBSR and mindfulness practice is about coming back to this moment and noticing where the uncomfortableness is in your body. So maybe coming back to the breath, noticing, a tightness in your chest. And when you focus in on your body, you get out of your head, and it kind of slows down that snowball effect, so it's not coming down on you like an avalanche, smothering you. And people have noticed that they're starting to feel better even with uncomfortableness.
Describe the MBSR seminars that you lead. Who can attend? How many people attend? How long are the sessions? How often are the sessions? And are there other leaders with you?
The MBSR courses, I received my training in Winnipeg. My teacher was Dr. Stephen Hicks. He's a professor at University in Ottawa, and he was trained by, I believe, John Kabat-Zinn, the University of Massachusetts, Boston. You can receive BSR training a number of places in Manitoba. I believe in Brandon, myself and my partner, Dr. Karen Narduzzi, are the only facilitators of MBSR in Brandon. Not to say that you couldn't take a mindfulness course from someone in Brandon, but it wouldn't be a mindfulness-based stress reduction course, because there's very strict sort of a format to it. But in Winnipeg, you can take MBSR through the Canadian Mental Health Association Winnipeg. You can go on their website, CMHA Winnipeg Mindfulness, and see the courses that are offered. You can take BSR from Clinic in Winnipeg, and I believe the University of Winnipeg also run a mindfulness-based stress reduction course. Here in Brandon, myself and Dr. Karen Narduzzi, we offer the course in the fall and again in the spring. So we've been offering it twice a year since 2011. Course is open to anyone willing to donate their time and effort into practicing mindfulness and meditation. The 8-week program, once a week for 8 weeks, and it's about 2.5 hours each session. And then, like I mentioned earlier, then there's a full day called the Day of Mindfulness towards the end of the 8 weeks. It's quite a commitment. It's close to 33 hours. It'd be like taking a 3-hour credit course at university. And during a usual class, we would start off with a meditation, either a body scan lying down meditation or a sitting meditation, and followed up by an inquiry, checking in, see what people noticed for maybe 15, 20 minutes. And then we would maybe move into some mindful yoga, do some light yoga to notice different sensations in the body and to help to kind of solidify the different principles of mindfulness, such as patience, using the beginner's mind to see things like you've saw them for the first time and to be aware that you don't know everything, letting go of wanting it to be any different than what it is, accepting this moment just the way it is, sometimes saying to ourselves, this is it in this moment. Also, the practice of mindfulness helps us to be honest and authentic with ourselves and non-judgmental, living in the moment, choosing to live in this moment. Even though this moment might not be exactly the way we want it, we can just let it be and let go of wanting it to be any different than what it is. So when we practice this, we can feel comfortable when it's not even exactly the way we want it. It's non-judgmental. And it's about being vulnerable with yourself, taking a chance on yourself because you're worth it. We talk about self-worth, talk about vulnerability. Sometimes you need to take a chance on yourself, even though you know that there's no guarantees. So you need to risk a bit, whether it be for a job, going to school, asking someone out, moving to a different city. Sometimes you need to take those chances. And I find that the practice of mindfulness gives us that platform from which to work from. So right now, we're actually in the middle, towards the end of our MBSR course here in Brandon. We usually offer the MBSR course at the university in the Knowles Douglas building on the third floor called the Elephant Room. But we have held it in other areas. The Elephant Room is not available for those 8 weeks. We run it, right now we're running it Wednesdays, 7 p.m. till about 9:30 at Knox United Church. And so it is open to anyone in the community of Brandon or anyone with any condition, whether you have physical illness or mental health illness, or just wanting to learn more about yourself and make some self-improvement. It'll benefit anyone for any reason, but you have to remember to, as soon as you set that goal, to let it go and then just engage in the process.
Does MBSR work with other therapy? Can we say that MBSR is preventative therapy as well for mental wellness? Can MBSR be an option for people who wish to limit or halt their use of anti-anxiety medications?
We talk about mindfulness and mindfulness-based stress reduction. If it's for illness, whether it be a physical illness or a mental health issue, we talk about it as being an adjunctive therapy. Adjunctive therapy means an add-on. It means along with. So if a person is taking the mindfulness course because they're feeling depressed and they want to prevent, hopefully further depressions in the future, we wouldn't say, okay, come and take the course and stop taking your antidepressant medication, because that's between you and your doctor, you and your psychiatrist. It's an add-on therapy. Even though they say that mindfulness, the practice of mindfulness, is as effective or even more effective now than an antidepressant for mild to moderate depression, we're not going to tell you that you can go off your medications. That'd be a decision that you make with your doctor. Mindfulness has helped people with depression, people with anxiety. It has helped people to cut down on the amount of medication maybe that they're using for anxiety. Even people who have high blood pressure. I've taken their blood pressure before a mindfulness session and then afterwards, and they say they can't believe it's that low. It hasn't been that low in a long time. So the way that mindfulness works is if you are just sitting or lying down in the moment and just noticing what's coming up and not resisting anything. It's our resistance that creates stress. I think it's Mark Twain said, it's not stress that kills us, it's our reaction to it. Or that it kind of loosely goes like, I've been in some terrible places in my life, stressful situations. Some of them are actually true. So we make up a lot of complications and stress in our mind when we don't want things to be like this because it's uncomfortable, or we just thought it would be a different way. We have all kinds of expectations. I read a study recently where two groups were receiving the flu vaccine. One group was practicing mindfulness, so they were doing the MBSR program, and it was after 8 weeks that both groups took a blood sample to see what the antibody count was for both groups. So they were injected with the flu vaccine, the antigen, and then you build antibodies to that antigen that helps you to fight off the flu. So they found that in the group that had the mindfulness-based practice, that they built up twice as many antibodies to the antigen as the group that hadn't practiced mindfulness. So when your body's in a more calmer, homeostatic state, it can work better for itself. It can help to repair itself much easier than when it's focused on, fight or flight or freeze sort of sensation. So mindfulness helps us to respond in this moment, not to react. And it's when we react, that's when we are jumping conclusions and we have this adrenaline rush, and we need energy for that. So we get a dump of glucose into our bloodstream, and then our pancreas has to kick in and shoot in insulin to bring it back down. And if you're constantly kind of worrying and getting stressed and have anxiety about things, this is constantly on the go. So your body's never in kind of that homeostatic state, and so it's always kind of fighting against itself.
In keeping with the theme of the series, Reduce the Stigma, does MBSR provide an alternative to clinical settings, and perhaps it is easier for one to address mental health concerns in a less institutionalized setting, and install healthy, proactive habits without the social stigma of a perceived mental illness?
Notice that people who practice mindfulness and mindfulness meditation, they have kind of a newfound confidence, because the mindfulness is about your time, your practice. It's about, the way it works for depression is that it's about becoming aware of our old ways of thinking and our old ways of reacting. And it's about breaking those habits, breaking those trains of thought, not by pushing them away or not by numbing them with drugs or alcohol or doing something to excess to kind of get away from it. But it's about just noticing, those thoughts or those judgments that may come up, and not relating to them, not like pushing away, not numbing. And it's about then choosing your focus in this moment right now. And when you are in the moment, you become more aware of your mind, you become more aware of your body and your spirit. And the spirit that I'm talking about is kind of what makes you tick. Who are you? What makes you different than me? Well, I like to play golf. I like to sit down and discuss maybe politics with someone. I like to have an honest, open, authentic relationship with others based on, sort of trust. I don't like to, just sort of be superficial. I like to eat ice cream. I like to watch the stars. I like to go fishing. I like to have romantic dinners. So mindfulness helps us to be comfortable in our own skin by becoming honest and authentic with ourselves. And if we're honest and authentic with ourselves, and we're not, doing things because the media says we should do this to be like this, that we should own this type of car, we're not trying to keep up with the Joneses, then there's less anxiety because we're not trying to keep up. We're just allowing ourselves to be totally ourselves. So for that reason, you can see how it can be a much more sustainable practice, and it can take you where you need to go. It continues to get better and better each and every day, the more that you practice daily mindful activities such as eating or washing the dishes mindfully, noticing the suds and the smell of maybe the soap you're using, and the water that's hot or cool, feeling the slipperiness. When you incorporate your five senses into the moment, you're much more liable to be in the moment than in your head and predicting the future, trying to predict the future, becoming anxious because I don't think it's going to work out, or ruminating about the past. So mindfulness is actually about getting out of your head and living in this moment. People who practicing it are much more confident, and I noticed that at work here, that people are feeling more confident around others and are liable to be more open and honest and vulnerable, and they start taking chances on themselves because they're worth it. They start seeing that.
What events, campaigns, or gatherings are you aware of that promotes MBSR? You mentioned Manitoba as a mindful province earlier. What does that mean?
Well, a mindful province is kind of a dream. It would be nice to see Brandon as a mindful city, and maybe some days to see Manitoba as a mindful province. One of the other volunteer activities that I'm involved with is fair trade. Brandon, in the last couple of years, has become a fair trade town. And there's 21 or maybe 22 fair trade towns now across Canada. Fair trade is a choice, like mindfulness. Mindfulness is a choice. Fair trade is a sustainable practice for the farmer, for the producer, for the retailer, just like mindfulness. So the two kind of go hand in hand. Manitoba is going to become, hopefully, the first fair trade province in all of Canada. We're just waiting for Winnipeg to become a fair trade city, and then I believe that the next thing will be Manitoba becoming a fair trade province. So it would be nice in the future to see Brandon and Winnipeg and the province of Manitoba to become a fair trade province. Like I was talking earlier about Mindful UK, it sounds like the UK is moving towards becoming a mindful country. I guess we need the political support for that, but I think it's going to save us millions and millions and millions of dollars in the long run if we offer mindfulness in all these different settings, because again, it is a healthy choice, it is a sustainable practice, and it's something that's pretty easy to do anywhere, whether you're on the bus, driving your car, in the line at a superstore, eating, working. It's all about increasing our emotional IQ, or what we call as EQ. It's kind of on a side note, emotional IQ is self-awareness, self-management, being motivated for self-improvement, empathy, being able to kind of step inside someone else's shoes, kind of trying to understand what they're going through. And the other point about emotional IQ is being able to understand others, being able to know when you need to maybe step in and help them out and when to give them space. So the practice of mindfulness automatically raises your EQ. And big businesses nowadays are doing EQ tests. You can do one online, check out your emotional IQ. It's something that you can increase with just self-awareness and self-management.
Okay, thank you very much for this great interview. Please provide information on how one may contact you for information or how to participate in MBSR seminars.
If you would like to receive more information about mindfulness or mindfulness-based stress reduction, you can contact me, Rick Piche, P-I-C-H-E, at 724-8819 or mbsrbrandon at gmail.com. mbsrbrandon@gmail.com, and I can email you back with information either about mindfulness in the schools, or about a mindfulness course in this area or around Winnipeg. I can get you contacted with that. Something that I'm offering coming this May is a 3-hour mindfulness session. So it's not mindfulness-based stress reduction, because MBSR has to be giving either over an 8-week period or 5 full 12-hour days. So it's pretty intense.
That was Rick Piche, registered psychiatric nurse at Center for Adult Psychiatry, who, with Dr. Karen Arduzzi, also from CAP, have been running mindfulness-based stress reduction seminars in Brandon, helping people develop mindfulness as a daily practice in maintaining mental well-being. I hope that you found this interview as informative as I did, and that this episode was helpful towards your understanding of mindfulness and mental well-being. My name is Jan Eck. You have been listening to Reduce the Stigma.
You are listening to Reduce the Stigma, CJ106 docu-series funded by Community Radio Fund of Canada, narrated by Jan Eck, produced by Jan Eck, Matthew Higgs, Tyler Addison, and Janice Brohl.